Eczema is one of the most common chronic pediatric skin conditions that we'll see. It can happen from infancy to childhood to teenage years. It is something that a lot of kids do struggle with, and you can often see it in combination with conditions such as allergies or asthma, and sometimes a family history of those kinds of conditions can suggest that kids may be at risk for eczema as well. Another term for eczema is atopic dermatitis, and that kind of points towards those other conditions like asthma and allergies. The mainstay of treatment for eczema is twofold. Moisturizing is one of the most important things, so making sure that we're not irritating that already sensitive skin, limiting really long baths, moisturizing with a good lotion afterwards, and then when it does get flared up, you want to use topical steroids to treat up that inflammation. Eczema flares present as rough, scaly patches on the skin, and they can sometimes be very itchy, especially for young kids, and that can lead to secondary infections. So if the steroids aren't enough to calm down the inflammation, sometimes kids will need antibiotic treatment as well. A lot of parents are nervous about the thought of using steroids. Understandably, kids who do need steroids long term can have some side effects. Topical steroids are generally very safe, and we always start with the least potent steroid, and that'll be medicines called hydrocortisone, and we step it up if the rash isn't improving. When you use it topically, we always recommend doing a thin layer, and we talk about using it for the shortest amount of time as needed to make sure the rash gets better. It's very important to remember that eczema is a chronic condition. It's not something that will be fixed overnight, so it's important to stay on top of any of those rough patches, making sure we're working on that sensitive skin care and using your steroid treatments as directed by your physician. And you can always call or come visit us if you have concerns or questions about how your child is doing.